Here at ABC 24, we are all about keeping you healthy. September is Healthy Aging Month, and we are taking a look at a silent killer, high cholesterol. A lot of people don't even know they have it because it really doesn't have any symptoms. In fact, the CDC says 28 million people have cholesterol that is higher than it should be. Our Lakita Johnson is live at Methodist Hospital this morning. Good morning, Lakita. So what did you learn about all of this?
Good morning, Aaron. The holiday seasons are right around the corner, and so I know we're ready to eat, drink, be merry, be happy, all of that good stuff. But the eating and the drinking part, we got to do all that in moderation, because if it's one thing about high cholesterol, it can increase the risk of getting heart disease, which is a leading cause of death, and for stroke. And so we spoke with a doctor about how you can be healthy beyond the holidays, and he says that it goes beyond just having a good diet. Take a listen.
Everybody should get their cholesterol checked. I think it's really important. Yes, some people at higher risk of heart disease, strokes, but everybody should know their cholesterol numbers and know what their targets should be.
Unfortunately, bad cholesterol is a silent killer. Methodist South Hospital Chief Medical Officer Dr. Amit Prasad says it's important to get your primary physician to do a blood test so that you know your levels.
It is important for you to understand what these numbers mean. So he's probably going to come back to you with three different numbers.
One of those numbers will be your LDL, or low density lipoprotein. It's the bad cholesterol. It builds up on the wall of your blood vessels, leaving plaque over a period of time, which narrows your blood vessels and blocks the flow to and from your heart and other organs.
The other may be the HDL, or the high density lipoprotein, which is the good cholesterol. The third number he may come to you with is the triglyceride level. Now, the LDL, or the bad cholesterol, lower is better. This cholesterol can increase the risk of heart disease and strokes. And so you need to do all you can to keep that number as low as possible.
Prasad says there are three important steps that you can take to either lower your cholesterol or maintain your healthy levels, starting with exercise.
That can actually help increase your HDL, or your good cholesterol. Now, most people need at least 150 minutes of exercise a week. And so, moderate intensity exercise, walking is wonderful if you can do that, or any kind of physical activity that raises your heart rate. If you're not able to walk, you can do other things that may help.
Your diet is also key. Cholesterol is mainly in different meats, egg yolks, shrimp, and whole milk dairy products. So monitoring how many milligrams you consume is important. Instead, you should eat foods that are high in soluble fiber, like whole grain, cereals, fruits, and legumes. This will help prevent your digestive tract from absorbing cholesterol.
Really, a heart-healthy diet is not just one thing. It's several things you have to look at.
Prasad also recommends talking to your doctor or your dietitian about how many milligrams of cholesterol you should be consuming on a daily basis. Another thing to keep in mind here, guys, is that alcohol intake. The more you drink, the more calories you can gain, which the more weight you can gain. And so that, your blood levels can also go up, and it also just puts your health at risk. So another thing to keep in mind is that doctors say that men should consume no more than 2 drinks a day. Women should consume no more than 1 drink a day. For now, Memphis, I'm Lakita Johnson. Back to you guys.